Well, the National eHealth Collaborative is a wonderful and unique public-private nonprofit organization that can serve as a neutral convener and educator on all things health information technology related.
NeHC's role is to really be a trusted source of information for the health information industry, to bring together all of the disparate information sources that are out there and really just be a trusted depository of information.
NeHC has an important role. We are a public-private partnership working to bring together the various stakeholders for key discussions, policy conversations, and to move forward with recommendations on how to move this forward in the most safe and effective way possible.
NeHC provides the public-private partnership that really allows us to achieve the goals of National Health Information Exchange, and using this for surveillance, for public health issues, for quality measurement, quality improvement, for direct patient care.
A lot of the health IT field is going to be focused on the actual exchange of information in a secure and private manner. In what ways will the consumer play a role in health information exchange? What way will the providers play a role in health information exchange? And how will we do that in a way in which the consumer has rights as to who gets to see that information and what privacy should be centered around that information exchange?
I see health IT moving beyond just the typical borders what we see today in overall healthcare, in that sense that we think of device architectures and software and services inside the hospital, inside the physician office. But what we're going to see is ubiquity of this healthcare move outside of those facilities. We'll see healthcare move beyond just the simple facilities of today, where I have to go to a hospital or I have to go to a physician office and actually have my measurements taken, and actually come into the home and be more around us all the time. It'll become more personal.
I have to believe that we will be well on our way to having data exchange across the country in 5 years. I think the other thing that we're seeing is that as we court the consumer interests, we really see a much more active role in different kinds of partnerships between providers and patients, or providers and consumers.
Well, educating the public, educating the providers who are investing in electronic health records, educating and informing the state-designated entities that are receiving high-tech funds for interoperability, and promoting adoption in those communities, including the regional extension centers.
Well, NeHC helps our organization in a lot of different ways. Again, by education in particular, by continuing to promote health information exchange, and also really being kind of the repository of all the information that they're really collecting through ONC, and really being able to have that available for not only us but other members that we represent on the board.
Helping everybody understand it is really about consumer and stakeholder engagement and education, and that's NeHC.